Good morning, everyone. I want to start by saying that we honor the sacredness and importance of this land and of the ancestors that once walked where we are standing today. The Anishinaabe, the Inuit, the Dene, the Dakota, the Inuit, and the Anishinaabe nations, and the Red River Métis Nation, who paved the way to what is now known as Manitoba, home to all treaty people. I am pleased to be joining Minister Asagwara, Dr. Kendiss Olafson, Heidi Adamko, and Karen Samson, and everyone gathered here today to hear about some great work and initiatives that will improve Manitoba's healthcare system and will ultimately help to reduce wait times and improve care in our emergency departments. These speakers will be providing details about the work and impact it will have, but I would like to express my gratitude to the Manitoba government, Shared Health, and all the clinical and health system leaders, as well as frontline staff and management who have informed and contributed to this work. Because we know that if we expect to make progress and address the challenges facing our health system, significant focus and efforts like what we'll be hearing about today are required. I now welcome Minister Asagwara to the podium to share this exciting news.
Thanks, Dr. Young. Thanks so much. Appreciate your work. Hi, everyone. Thank you so much for joining us today. And I want to thank everybody here who has joined us today. Just an absolutely wonderful group of experts and leaders in healthcare. When you show up at an emergency room, it is often one of the scariest moments of your life. We know why we're at this point in our healthcare system. It's because of cuts made by the previous government and closures. And we're seeing the consequences of those cuts in our monthly wait times reporting. We have to fix it. We started as a government by hiring over 1,500 net new healthcare workers. That number has grown to over 1,600 net new healthcare workers. We have added hundreds of beds, brought hundreds of beds that are fully staffed online across our system. And now we need to turn our attention to lowering wait times for patients in the emergency departments. Today, I'm proud to announce that we have formed a lower wait times and system improvement team. They have been tasked with lowering wait times in emergency departments, and we know that access block is one of the main barriers to lowering wait times. To truly fix access block, we have to look at problems in all parts of the hospital and in our communities. We have to break down the silos and work together. We cannot just rely on those in our EDs to do this. We have to bring everybody on board. That's why our lower wait times and system improvement team has members who work across the system. From ICUs to family medicine, this team brings their own expert perspectives. We know that the people who wait longest in our emergency rooms are often from racialized or marginalized communities. A major part of this work is building a more equitable healthcare system. The team has been developing a lower wait times strategy in conjunction with folks from the front lines, and now we're ready to bring this strategy forward and expand on this, expand through more consultation with the front lines for their input and support as we move forward. So I'd like to take a moment to reassure those working on the front lines, the staff who have been doing this work and providing care to Manitobans at the bedside and who may be wary of this work. I don't blame you. I don't blame you if you are wary. Under the previous government, any changes made to healthcare meant cuts. That was your experience. So let me be clear about what this is about. It's about adding to our system. It's about adding resources, adding services, and adding people. This is about adding to the quality of work you do every single day without adding to your workload. These initiatives are hyper-targeted with specific outcomes that will impact the next chain of decision-making in a patient's care experience. These initiatives will support faster recovery, a better experience, and more capacity in the system overall and as a whole. This document, I want to also be clear, is not written in stone. It's not fixed in stone. The ideas are not cemented by any means. There's flexibility. It's important that folks know that they're not finite. We know that in order for this work to be successful and to be meaningful, we need to have the front lines fully on board. And so we're going to be flexible. We're going to be able to shift our course if we need to. Manitobans, every single day, ER staff and team members take care of you. They provide care for you. They provide a steady hand and comfort during some of our most difficult times as individuals and families. These healthcare workers deserve the best. They deserve the best workplace possible. And Manitoba patients deserve the fastest and best quality care possible. Now, we have a long road ahead of us. We know this. And let's be honest, wait times are very, very long. But we have to try, and we have to move forward together. Thank you. Thank you.
Thank you.
Thank you, Dr.
Thank you, Mr. Asagwara. Next, I'd like to welcome co-lead of the Lower Wait Times and System Improvement Team, Dr. Kendiss Olafson. Dr. Kendiss Olafson is an internal medicine and critical care physician at HSC and also a leading researcher in the field of critical care medicine and also a classmate of mine from med school 30 years ago. Dr. Olafson.
Please clap for that.
Thank you, Dr. Young and Minister Asagwara. Good morning. Thank you for joining us today. I am so proud to be part of this important work to improve access to emergency care for Manitobans. I want to take a moment to recognize my fellow co-chair, Dr. Paul Ratana, but also our entire team of lower wait times and system improvements. Their dedication and expertise are driving this work, and I am inspired by their commitment and vision for a better healthcare system in Manitoba. The core of this mission is to improve timely access to high-quality care, not just in the emergency department, but across the system, outpatient, inpatient, and long-term care. Because we know that emergency care doesn't happen in isolation. It is deeply connected to the entire healthcare system. We recognize that when patients come to emergency department, they're often in a moment of stress and crisis. They deserve care that is not only timely and coordinated, but also compassionate. Additionally, the staff who provide that care are nurses, physicians, allied health, aides, clerks, and everyone else. They deserve a working environment that brings meaning to their work, supports their well-being, fosters collaboration, and helps them thrive professionally. Emergency department outcomes don't start and end in the emergency room. They reflect on how the whole system functions. And that is why our work focuses on how care is organized, how teams function, and where we can target efforts for the greatest impact. As physician and nurse leaders who are active in patient care, we see these challenges every day. We know the strain of the system. We know that the strain of the system is under, but we also know that the time for change is now. If we want to improve the health of our system, we need to act, and we need to act together. The Lower Wait Time and System Improvement Team is deeply committed to this work. We are here to serve patients and staff. We take that responsibility very seriously. That means listening, really listening to those on the front line and our patient and family partners. We want to build upon strategies that work, incorporating their insights into solutions and building the kind of teams that support one another across disciplines and departments. It's important to acknowledge that some may feel a bit of trepidation in the work to come, but I want to assure all healthcare staff, patients, and their families that this work is about adding value, adding people, adding services, expanding capacity. It is about removing barriers and breaking down silos, not about adding more work. It is about working together in a way that strengthens what we already have and builds towards something better. We also want to be clear. We know that this is not easy work. Our eyes are wide open to the challenges we face. However, I am so encouraged by the dedication and strong commitment to patient care that we have witnessed across all the sites and teams that we have visited. By grounding our work in values like health equity and patient-centered care and safety, we are creating a future where patients receive the care that they need and where healthcare workers feel valued, supported, and part of something meaningful. Together, we're not just aiming for a better emergency department. We're building a stronger, more responsive healthcare system for everyone. Thank you.
Next up on our program today is another member of the Lower Wait Times and System Improvement Team, Karen Samson, who is the Executive Director of the Health Services and Chief Nursing Officer of the St. Boniface Hospital. Welcome, Karen.
Thank you, Dr. Young, Minister. As a nurse and a member of this Lower Wait Time and System Improvement Team, I am honored to be speaking to you today about the essential role of nursing, not only in the emergency department, but in the healthcare system as a whole. Because the emergency department is not a standalone space, we know there is deeply interconnected components that are part of our nursing system, from community to inpatient units to long-term care. We are interconnected. Nurses are often the first point of contact and the constant presence through a patient's journey, whether it's coordinating a safe discharge home to the community, admitting patients into a very busy medicine unit, or providing bedside care in an emergency department. We are there. And that presence, that continuity is what makes nursing such a critical part of improving flow, ensuring safety, and providing compassionate care. We also know that improving emergency department outcomes depends on how well the entire system works together, and nursing teams understand that and are the backbone of that work. Our ability to assess, act, collaborate, and advocate for patients in real time is what ensures that flow keeps moving. The invisible work behind the scenes that nurses also provide on a daily basis to prevent delays, de-escalate crises, and support patients and family through some of the worst times of their lives. The improvement efforts of the team, we recognize and respect the value of nursing. Our voice is being heard in shaping changes that are practical, sustainable, and focused on supporting one another as a team. The goal is not disruption, it's evolution. Evolution towards a system that listens, adapts, and strengthens care for both patients and those providing the care. I've been a nurse for 37 years, and I can honestly say I am deeply inspired by the level of collaboration I have witnessed since becoming part of this longer wait time and system improvement team. Their genuine commitment to drawing on the expertise of the frontline teams who are at the patient's bedsides is essential to this work and to help improve our health system. This includes collaborating with patients and family partners. As nurses, we are ready to lead, support, and partner in these changes that will advocate for these improvements, not just in emergency departments, but across every care setting that touches an emergency patient. Together, we can build a system that reflects the values we live every day: compassion, connection, and commitment. Thank you.
Yes, thank you, Karen. Well said.
Thank you.
Next, I would like to welcome Heidi Adamko. There you improvement lead on the lower wait times and system improvement team, who will be sharing her experience and how incremental changes can make a meaningful difference in a patient's healthcare journey. With a background in engineering and a passion for project management and a quality improvement, Heidi has been involved in several transformational projects within Manitoba's healthcare system, including the implementation of the Emergency Department Information System, EDIS, to all emergency, which is being used in all emergency departments in the city. Welcome, Heidi.
Thank you, Dr. Young. Good morning, everyone. Thank you, Minister Asagwara, Government of Manitoba, Dr. Kendiss Olafson, and Karen Samson from the Lower Wait Times and System Improvement team. Today, I want to share my mom's healthcare experience in the last week of her life, a story that may resonate with other Manitobans. You may have never guessed it, but my mom had cancer, and she was doing so well. Until one Thursday evening, last May, she started having pain in her side. It persisted, and the next day she went to urgent care, only to be told she'd be waiting all night. My sister sat with her, scared, not knowing what was wrong, and worried that her condition would worsen the longer they waited. She received a bed at 4 a.m., was given medication, and later that morning, we were told that she was being admitted to internal medicine at another hospital. When we arrived at that hospital, we started from scratch in the waiting room of the emergency department, including starting the medication with the triage nurse having to find a physician to complete the medication order. My mom was placed in an emergency bed at 10 p.m., even though we were told we were admitted to internal medicine. The medicine doctor visited the next morning, and then a day later determined nothing could be done for my mom and discharged her from the emergency department. The emergency room physician told us our mom was dying and supplied us with information on how to access emergency care when she needed it. By Tuesday, Mom's speech was slurred, and she was dropping things. Her neurologist suggested she go to the emergency department for a CT scan. We arrived at 6 p.m., and even though the triage nurse had a copy of the form the neurologist had completed, she waited 16 hours before being taken to the CT. Once my mom finally had her CT scan, we all went home, exhausted from yet another sleepless night in a waiting room. On Wednesday, the neurologist, physicians, oncologist, emergency room doctors were all calling my parents, but my dad refused to pick up, stating Mom needed rest. They didn't want her to die at home, but refused to spend another night in a waiting room. The trauma from waiting had them refusing to receive care. On Thursday, we called an ambulance. The attendants said her vitals were normal and said that Mom didn't need an ambulance. They told Mom that she would have to wait in the waiting room when she gets there, just like everyone else. So naturally, she refused to go. Eventually, we convinced her to go, and Mom was finally taken to the ER, where she was given a bed immediately after being triaged, and then admitted to the medicine ward in the hospital. Later, she was moved to a beautiful room in palliative care, where she spent her last Sunday afternoon surrounded by family and friends, and she passed away that evening. In my mom's last 9 days, she spent 2 nights and 1 day in waiting rooms, and then 3 days in emergency beds waiting for a hospital bed. Her story isn't unique. Unfortunately, these waits have become the normal experience for Manitobans accessing acute care. My mom was a privileged, white, middle-class citizen with loved ones to proactively advocate for her care. I recognize that many others face much greater barriers, and our team is committed to breaking down these barriers. At some point, each of us will find ourselves waiting for care. And my hope is that no one waits as long as my mom did in the final week of their life. This is why I'm grateful to be part of the Lower Wait Times and System Improvement team, which is filled with people who have a wealth of knowledge, experience in the Manitoba healthcare system, and who are working to address this exact issue. Throughout my mom's healthcare journey, she received such high-quality care, and we were treated with such empathy. However, there are some small things that would have made a big difference in my mom's experience, such as a warm blanket in the waiting room, a doctor visiting mom for a few minutes even in the waiting room to start her care. This small act would have alleviated our worries about whether the wait would make her condition worse. When she was transferred between hospitals, it would be great to have her go directly up to internal medicine, even temporarily into a bed in the hall rather than in the noisy waiting room of the emergency department. It felt like mom's care was delayed by a day because we happened to choose the wrong hospital. Or continuing her pain medication between hospitals without having to reorder it. Or the neurologist being able to send mom directly for an urgent CT rather than having to go to the emergency department. With the Lower Wait Times and System Improvement team, and with the support from Shared Health, the Winnipeg Regional Health Authority, and the Government of Manitoba, we can take action to ensure that all of us who live in this province can access high-quality care without having to wait so long for it. Thank you for letting me share my story and listening to others share about this important announcement today.
Thank you for sharing, Heidi. With that, our formal program is over. I want to thank Minister Asagwara and all our speakers today for sharing your expertise and insights about this exciting new initiative. And thank you everyone for joining us here today to share on this good news. And with that, we will be open for questions. Thank you.
There have been task forces in the past, studies, maybe committees. I'm sure if I go back through our archives, I'll find evidence of that. So how can Manitobans be confident that this one is going to work if things are so bad right now?
Sure.
How can we be confident that there will be any kind of change or improvement?
Sure. First, I want to thank Heidi for sharing your personal story. We hear stories from Manitobans all the time about their experiences in our emergency departments. And Heidi's got a tremendous amount of expertise that is a part of this team doing this really important work. But I think that you can see from her personal story how connected this team is to making a difference in doing this work and in the ways we do this work together. Certainly, as I said in my remarks, I can appreciate and understand why healthcare workers and even broadly Manitobans might be wary of this. Historically, under the previous government, when there was any announcement made about changes to healthcare, it always meant cuts. It always led to closures of emergency rooms or massive structural changes that saw us lose resources. What we're here to say today is that we are here to add capacity. We're here to add people to the front lines. We're here to add quality to the care that Manitobans receive. And that this work is being led by a team of folks from across the system who provide care to Manitobans each and every day. These are folks who understand the system and who are accountable in the way they do the work. Previously what we've seen with a task force under the previous government, which I'm sure is what lots of people are thinking about right now, we saw a group that really, we didn't know who they were accountable to. They had a massive budget and they could just make decisions however they chose. This is a table that's working together. They are truly collaborating across the system, listening to the front lines, and they are accountable to myself as the minister. They're accountable to leadership throughout the system, and they're accountable to their colleagues who are on the front lines of emergency departments and aspects of our healthcare system. So it's fundamentally a very different structure that has patients and improving patient care and improving wait times for families at the heart of it.
For this task force, what's the cost to taxpayers?
It's not a task force. I want to be clear, very clear. It's a lowering wait times and system improvement team. The resources, we can get you more details around that, but what I will say is that our government has budgeted and prepared for this. There is money in our 25-26 budget. May not be identified in one single pot, but it's in different areas of our budget to make sure that we can fund this effort.
Why do you're saying this is not a task force? How is this team different than that? Like,
Outside of the name, being the lower wait times and system improvement team, structurally it's very different. We have folks from across the system, and that was very intentional because the experts have made very clear to us, and if you talk to folks who work in our emergency departments, they will tell you that a number of the challenges they face in the emergency department are not in the emergency department. It's in other aspects of the healthcare system, different parts of the hospital, and in our communities. And so this team of experts are collaborating, again, from the ICU to family medicine to community, to equity, to making sure that the approach they're taking is one of partnership, working with the front lines, is accountable, and using the resources that exist within the system and resources that are dedicated in our budget to address this.
What would you say to people who maybe would look at this and think it's just another layer of bureaucracy?
I would say that these are all experts and leaders who are already a part of our healthcare system. This is a group of folks who are committed to making healthcare better, to improving wait times, who have had ideas for years, but never had the structure or the support of government to not only bring those ideas forward and work with the front lines, but truly the support and the mandate to get the work done. And so structurally, this is a very different approach. It's an approach that, quite frankly, is long overdue. And fundamentally, there's an opportunity here that I think we're all very excited about to make changes that are not only going to benefit the emergency departments and lower those wait times, but improve care across the system as well.
Manitobans will probably, you share, they'll probably want to know specific things, like what is specifically being done to reduce wait times?
Sure.
What is specifically going to be done, aside from setting up a team?
That's a great question. I want to be clear, this team has been working very hard for months already. They have been going in and meeting with the front lines, meeting with healthcare leadership, assessing and reviewing protocols and understanding what areas we need to really focus in on and what targeted approaches we need to take in order to make the changes that Manitobans want to see. I'm going to ask Dr. Olafson to speak more specifically to the details, but this strategy that's been put together to this point is very comprehensive. It has identified key areas of focus, and we look forward to sharing more details about that with the front lines as they go and expand those consultations. But I'm going to ask Dr. Olafson to speak more to this.
Hiring staff, is this?
Oh, absolutely. Absolutely. Fundamentally, I mean, people are a huge part of this. As I said, our government has hired over a net new 1,500. Now we know over 1,600 net new healthcare workers to the front lines of our healthcare system. That's a lot, but it's not enough. There's much more work we need to do to retain, to train, and recruit healthcare workers to the front lines, including in emergency departments. And so people, staffing, is a huge part of how we do this work successfully. Dr. Olafson?
Dr. Olafson to speak
Please.
about the specific
Go ahead.
initiatives. Yeah.
Thank you. This problem is complex. It's not going to have we don't have one specific project that's going to fix the numbers. And more importantly, we don't want to just fix the numbers. We actually want to fix and help the system. And so there is a lot of things that we're working on that deal with culture and how we organize our care. And so much of the challenges that we face in emergency room is what we call access block. People that are in the emergency who no longer need emergency care, but are waiting for care elsewhere, waiting for an inpatient bed or waiting for tests. And so much of our work is actually focused on outside the emerge so that we can increase flow throughout our system. And so with specific initiatives, things that we're doing is trying to develop a system that is less hospital-centric. And we want to support people in the community, meeting them where they're at. And so we currently have a CIVP program, a community IVP program that supports people receiving intravenous therapy at home. This is a great program, but there's opportunities to expand its impact. We previously in COVID, there was a virtual ward called VCOP that you might remember, of supporting people who were otherwise would be hospitalized, supporting them in their home environment. And so that virtual ward is scheduled to be reopened. This will allow capacity within the hospital and deal with that access block. We're looking at things within the culture, and so building up a framework of accountability, that when we look at the literature of ED overcrowding, that building up that framework and supporting and changing that culture is an important piece, and that really involves the entire system. The other thing we're looking at is how do we support people that are prior to coming to emergency room or that are in the waiting room. And so there are two initiatives that we're looking at that. One is 811, where we're joining health links as well as our vectors to make sure that people are going to the right place to receive the care that they need. And the other is looking at reducing the access block in triage. So if the emerge is overwhelmed, being able to see people in the waiting room and expand that area. The last thing is looking at how we deliver care within the hospital. And our patients are different than they were 50 years ago, and how we deliver care needs to be different. They are more complex, and they are elderly with lots of comorbidities. And we have to move away from individual practitioners to developing more high-functioning teams so that we can increase the efficiency, meet patients' needs, and allow them to not be in hospital as long. And I'm not sure if I forgot anything from the, yeah.
You just referenced the joining counseling and vectors to make sure patients are going in the right place. How exactly would that work out?
I will let someone else.
Yeah, I can speak a little bit, yeah. So the work is being done, and we've actually seen this work undertaken in other jurisdictions. So we know, I believe in Saskatchewan and BC, they've done work in this area to really streamline these important areas of healthcare, so vectors and health links, and make them more effective. I don't know about you, but I have used health links in the past, and I know people who have said, there's a better way we think that we can maximize that resource and make sure we're directing people, first of all, connecting them with the most appropriate person to have that conversation, and then redirect them to the most appropriate place to receive care. These are systems that have been in place for some time, and we've seen in other jurisdictions that when those things are brought together and the process is improved, that it really actually directly benefits the ED and brings those pressures down because you're getting people connected to other care that's more appropriate. So it's a really big opportunity. It's a great opportunity that we're really excited about. And I think it also speaks to work that our government has actively been doing to make sure that Manitobans have care options in their communities when they need them, like our extended hours primary care clinics, like our minor injury and illness clinics at the Misericordia and in Brandon, where we've seen over 11,000 Manitobans access those sites. Much more work to do, though.
When you say maximizing resources, though,
Yeah.
what does that look like in this program?
Yeah, it means that we've got virtual platforms, we've got specialists who are on those platforms, we have nurses and other folks who have the expertise to triage people over the phone, have those conversations, and redirect them to services more appropriately. And we need to make sure that as a system, we give them the options and the tools to make those referrals in the most appropriate ways. And so, this is an opportunity for us to create a platform that's much more comprehensive, that meets Manitobans' needs where they're at, and has them accessing services in their communities that make more sense in that moment than emergency departments.
When will Manitobans start to see wait times come down?
We would love to see those wait times come down immediately. right? Our goal is to work as aggressively and as quickly as we can, fundamentally hand in hand with the front lines to implement initiatives that folks know will make a difference. We are preserving the ability to be flexible, which we know is really, really important. But ultimately, this work is being done to lower those wait times for Manitobans and see real system improvement. We didn't get to where we are in our healthcare system with these wait times overnight. It was years of cuts and poor decisions that got us here. It is going to take us time to really, really see the big changes we want to see. But this is an effort that we've never seen in our province before. This is a collaborative, partnered team of experts who are doing work in a way we've never done it. And we fully expect that by doing this work together, we're going to make some real changes and improvements for Manitobans.
Access block was mentioned as one of the issues after a patient died in the ER here at HSC in January. What were the recommendations that came out of that critical incident review?
There were a number of recommendations that came out of the critical incident review with that patient death, and we've taken action on all of those recommendations. We took action very quickly. One of the fundamental pieces was improving capacity, making sure that there's adequate resource in our emergency departments, just as one example. And so what we've done as a government is make sure that consistently across our emergency departments, not only are they staffing to baseline, but going above that by utilizing the skills of healthcare aides who are trained and have the tools to assessments like vital signs and other things that can help ensure people are getting care in the emergency departments.
Was there anything specific to vulnerable people dealing with either addictions or who are homeless?
That's a great question.
Or maybe going to the ER and they may have some health concerns, but maybe they don't need to be in the ER.
Sure.
Is there anything specific to that?
Yeah, sure. That's a great question. Fundamentally, we know that healthcare providers, doctors, nurses, healthcare aides, the teams in emergency departments provide the best care possible to everyone and anyone who presents at an emergency department. We also know that in some cases, there are folks who are going to EDs to get their primary healthcare needs met, and that they would be better served accessing primary care in community. And so as a government, we're taking very real steps to address that. We are standing up a sobering center. We have a homelessness initiative, Your Way Home, a strategy to address homelessness that has seen a lot of success already. We are standing up a supervised consumption site. There's real work that we're doing on housing as well to ensure that folks who are accessing emergency departments, because they trust the staff who are there, they have relationships, they feel safe there. But we know that we need to do more in community, as Dr. Olafson has stated, more in community to make sure people's needs are met there and met appropriately. So there's a lot of work our government is doing on those three fronts, and in addition, additional initiatives.
Sorry, just apologies if this was just asked, but on that critical incident review, is it over? Is it finished? Will that be made public?
The critical incident review was completed. We actually have provided some of the recommendations that came out of that review and that report. We have provided all information to the family. They requested that, and we've made sure we've been very open, fully transparent with the family. I actually just had a conversation with them very, very recently to just see if they had any further questions or concerns. We want to make sure that we respect the family that was affected. And then again, we take the necessary steps collectively to prevent incidents like that from happening again.
After that death in the ER, one of the things that you were talking about was being transparent and open. But I didn't see the government or Shared Health come out and say, hey, public, here's the findings, here's the recommendations, here's what we're doing about it. Instead, we were asking you about it. So why no transparency? And will those recommendations be shared with the public?
Yeah, so I'm not sure why you haven't seen the information. We have shared the information. It was shared months ago at this point, and so we can get that information to you.
Was it published?
I spoke about it in the House. We shared it publicly by way of a release and information, I believe. So that information has been shared. It's months old at this point, but we'd be more than happy to get that information in your hands.
When did you find out about Mr. Diekman's
Yeah, I know that there are concerns around timing there. I will say that, anytime that there's any sort of a delay in information that's really important making its way to the appropriate people, that needs to be addressed. As a government, we've taken steps to improve protocols, and Shared Health is actively doing the work with their new leadership to ensure that protocols are in place that move information where it needs to go in a timely manner. As the Minister of Health, my responsibility is to make sure that key and important issues are being addressed, and that I'm fully aware of incidents and issues as they arise as needed. So that work is being done with leadership at Shared Health to make sure that those protocols are improved.
When did you or your staff found out about this?
What I would say is that not soon enough. Not soon enough. I'll say that. The information, did not flow as quickly as it should have. As a government and as the minister, there are a few things that are fundamentally important in terms of how our relationships with regional health authorities and leaders across the system function. So accountability, transparency, and communication are key. Whether you're talking about finances and whether or not folks are over budget, under budget, what have you, or tragedies, unfortunate tragedies in emergency departments, communication, accountability, and transparency is fundamentally important to those relationships. And there is actively work being done at Shared Health to improve in every one of those areas.
You found out in the morning, according to a statement from your office.
Mm-hmm.
Did that message not get relayed to the deputy minister?
The information was at some point communicated to the deputy minister. There were concerns about the timing of that, which I think is important to reflect on, which is, again, why work is actively being done at Shared Health to address that. We need to make sure that key pieces of information across our systems are being communicated in a timely manner, transparently and with accountability. And so, that particular situation, that tragedy, provided opportunities for us as a system to improve and to learn. And that work continues to be done. Part of why we're here today, this whole effort is about improving accountability. This whole effort is about improving communication and transparency. And that's an approach that, again, is at the core of the way that we govern. It has to be at the core of how we do healthcare. And we recognize that there are situations that arise that cause us to reflect, and that we have to do the work to improve, and that's what's being done.
Back to this strategy, or back to this team, we're talking about a strategy.
Yeah.
Is that strategy finished? Will it be released?
It is released. So we've shared the details of that strategy today. Dr. Olafson spoke to the details of that strategy. There's obviously more than she could articulate in this presser in terms of the fulsome details, but I do want to be very clear. This strategy is an evolving strategy. It is not finite. We have this wonderful opportunity in front of us to work really collaboratively with the front lines and make sure that we are flexible, that if we need to pivot or shift, that we give ourselves the room and the space to do that. And ultimately, these are key areas that have been identified as important opportunities for this team and the front lines to explore and to act on, to improve wait times, not only in the ED, but throughout the system as well.
Just to shift off topic a little bit, what did you make of the outcome of the federal election and the NDP candidates here not faring so well, and basically the party almost being wiped out in terms of seats?
Sure. Well, first I want to congratulate Prime Minister Carney on being elected Prime Minister. As the Minister of Health, my priority is to work with the federal Minister of Health and build a strong relationship that benefits the people of Manitoba. We have been able to work with the federal government previously to take historic steps at strengthening healthcare, like being the first jurisdiction to sign the pharmacare agreement, which is already making a difference in the lives of Manitobans with diabetes, those women and those who need HRT, and birth control and have reproductive health concerns and needs. And we know that there's much more work to be done. So on the NDP front, obviously it's difficult to see the outcome for the federal NDP. I think that the message is clear that there's a lot of work to be done at that level, but I do want to take a moment to congratulate Leah Gazan, who is the NDP MP for Winnipeg Centre, and we represent the community, downtown. That's a really important relationship, no matter who that person is. And I want to congratulate her on being reelected. And I look forward to working with her and, again, the federal government to make healthcare stronger for all Manitobans in our province.
Minister, can we throw to our Zoom reporters?
Yes.
Say Zoom on the mic, they'll let that.
Zoom on the mic. We're going to go to you folks.
Thank you very much, Minister. We have one reporter joining us today on Zoom, and we'll follow our usual one question, one follow-up format. I'll turn it over right now to Michelle from the Brandon Sun.
Hi, Michelle.
Michelle, are you there?
Hello, thank you very much for taking my questions. Are there different goals for different areas of the province? And I ask, wanting to know what the team will focus on or what has already been identified in Western Manitoba. We are, as you know, different from the big city hospitals.
That's such an important question. I really appreciate you asking about rural healthcare needs, Michelle. So there's going to be differences. You could even say site to site, right? This isn't a one-size-fits-all approach. The team is working very hard at site-to-site levels and certainly geographically and regionally to make sure that they understand the unique needs of different emergency departments and communities. What I can tell you is that in rural Manitoba, the biggest challenge when it comes to emergency department capacity really has to do with staffing. It's really about making sure we have the people on the front lines providing care. As a government, as a team, as a system, we have been able to successfully hire over 45 physicians across rural Manitoba. There is much more work, however, for us to do on that front. We've been able to hire nurses. There's much more work to do on that front. There's work that's being done to reopen long-term care beds across rural Manitoba because we know that also affects flow and access block. We've successfully reopened about 45% of the personal care home beds that were closed, that were shuttered under the previous PC government. Our target is to reopen about 80% of those beds in this year. So there's a lot of work happening in rural Manitoba to ensure that we are also addressing those concerns rurally, and it works in conjunction with the group here that's working very, very hard to improve wait times across the province.
Okay, well, thank you. And the last question, do you have an end date in mind or a median time wait in mind?
Sorry, can you repeat that question, Michelle?
So we've launched this this team now. How long are they going to be doing their work for? Next 6 months? Next 6 years? Is there an end date?
I can't see their faces behind me, Michelle, so I'm forever okay. No, these I can't thank these folks enough. These are passionate experts who are committed to making healthcare better for Manitobans. They do it every day at the bedside, and they're doing this work to lower wait times and improve the system really from the heart and through a lens that is long overdue in our province. What I can tell you is that these folks have been at this for months now. Collectively, we want to see some improvements, some real improvements in key metrics over the coming 6 months, I would say, to a year. And these folks are committed. We're all committed to doing this work together. What I would say is, in terms of doing the work of lowering wait times and improving the system, there's no end date to that. This is work that our government is committed to doing and doing intensively, and continuing to make sure that Manitobans are seeing the improvements that they deserve. So this work has been initiated and is ongoing and will continue and be supported by our government until we start to see those big improvements that Manitobans need. And even at that point, the work will continue to make sure it's sustained and we continue to improve the system.
Do you have a specific number, a specific target number that you're trying to hit?
We have key metrics that we are actively working to lower. We want to see improvements in our waiting to be seen times. We want to see improvements in the left without being seen times. We'd like to see those times come down meaningfully. So we here and there we've seen, even this month, the wait times improving. However, it's not enough, right? It's not enough. It's not to the degree that we know Manitobans deserve. So we'd like to see those metrics really improve over the next 6 months to a year, and to continue on that work.
Can your team share those metrics?
Yeah, absolutely. So we're looking at reducing those wait times by approximately an hour. I believe that's correct. But ultimately, our goal is to meaningfully lower those wait times and sustain that over time. So if the metrics improve in 4 months, in 8 months, and we see a reduction of 2 hours, great. But we need to sustain that, right? It's like saying, we've hired a net new 1,500, over 1,600 healthcare workers. Great. Well, that's done. We need to keep going. We need another 1,600 and more healthcare workers. So our goal is making sure that we are very, very dedicated, consistent with this effort, and focused on lowering the wait times in the long term.
And I just have one more for Heidi.
Please, yeah.
My condolences to you.
Thank you.
I mean, the healthcare system failed your family, and you're surrounded here by the people who are accountable to the healthcare system. What is it like to, I guess, have the platform here today to both share what happened to some of the people accountable and to have a voice in that team?
Well, I'm very grateful. When I graduated from engineering, I really wanted to work in healthcare because I saw there was so much opportunity to make a difference. And so, yeah, I'm extremely grateful to be part of this meaningful work. And Dr. Young mentioned that I put in place the emergency department information system many moons ago. And so I've always been passionate about making things better, reducing wait times throughout the system. And so this is a great honor. At the same time, I also recognize that we can do better for Manitobans, and we need to. We deserve better. I also think there's many resources within the system, but often as Manitobans we think we aren't good enough or we don't have enough, and so I think by putting a focus on ways that we can work with what we have can make a real meaningful impact.
Okay, thanks folks. Thank you, Dr. Young.